Welcome. My name is Dr. Cassie Flynn, and I am thrilled to be your moderator for tonight's official launch of Gutcheck VIVO, which is the first microbiome test designed specifically for women's health. I'm a postdoctoral research scientist at Nucleic Biologics, and it's been a privilege to contribute to this project alongside a team of passionate scientists and women who care deeply about bringing real personalized insights to women's health. We're so grateful to have you here with us as we celebrate this exciting milestone. Before we begin, we're going to do a few quick housekeeping items. So the emergency exits are actually just the door that you came in, and the bathrooms are out the door and to my right. We ask that you keep your phones on silent so that we can give our speakers our full attention. And if you're sharing any moments on social media tonight, you can use our tags that are shown here. So on Instagram, we are MyGutCheck, and on Facebook, we're just Gutcheck. If you haven't already, be sure to enter our giveaway for one of 3 free Vivo kits. Online attendees can sign up quickly here using this QR code. But if you're in the room with us, you can enter by visiting the welcome table after the presentations, which is just found over here, if you haven't already. We'll be announcing the winner this evening, so make sure you don't miss that chance. Also, for tonight only, our Gutcheck VIVO is available for a purchase at a special launch price. Be sure to visit the product table, again, just found over here, after the talks to learn more and talk to our team. Before we begin, we would like to take a moment for an important land acknowledgement. We acknowledge that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. Before we dive into tonight's agenda, I'd like to take a moment to share a little bit about Nucleic Biologics and the team behind this important work. At Nucleic, we're focused on turning cutting-edge microbiome science into real-world health solutions. Our goal is to help people better understand and improve their gut health by addressing microbiome imbalances that impact everything from digestion and immunity to mood and mental well-being. We're also pushing the science even further and developing new therapeutic approaches. And tonight you're going to see that firsthand through the launch of our new product, Gutcheck VIVO. So here is what to expect this evening. We'll hear from 4 incredible speakers covering everything from the uniqueness of your microbiome to how gut health influences hormones, postpartum recovery, and emotional well-being. Following our presentations around 8:15, we'll open the floor for one big Q&A, so we ask that you hold your questions until the end. And then after that, we're going to enjoy light refreshments, kombucha, and networking until 9. If you're a Leafs fan, you'll be home by the second period. So to kick off the evening, please join me in welcoming Sara Awija, an award-winning registered dietitian who specializes in maternal health and postpartum recovery. Please welcome Sara.
Hi. So today I'll be talking about how the trillions of bacteria in your gut lining could be the best thing part of the postpartum recovery. So I'm Sara Awija. I'm a registered dietitian. I graduated from McGill University. I specialize in gut health, mental health, and weight management. So I help women go through their pregnancy journey of gaining proper weight, their postpartum journey to help them support their gut as well as weight loss, and during perimenopause and menopause, so the hard times in women's lives where they're really struggling with mood, energy, and weight as well. I currently run my own practice at a Legion Wellness Center, and I've gotten the honor to win Best Dietitian 7 years in a row. This quote here sums up exactly why I became a dietitian. I've always been interested in preventative care rather than curative. I've always been very fascinated with how nutrition really is able to prevent a whole bunch of metabolic diseases as well reverse. I've gotten the honor to help so many people get off of their medications all through purely nutrition. And gut health has opened so many more doors for me and has made my journey as a dietitian so much better. So let's dive into gut flora, backtracking into pregnancy. There are so many hormonal changes that happen during pregnancy where your gut flora starts to get affected. So it can be in a good way because we do see that there's increased diversity in the gut flora during pregnancy to support all the different trimesters that women go through. So that's a good thing. a lot of my patients that come see me that have IBS prior to pregnancy, during pregnancy, that have IBS before pregnancy, as soon as they get pregnant, all their symptoms actually disappear. And we do relate that to the increase in the diversity in their gut flora. But super important that we are supporting this gut flora through nutrition. Otherwise, the inflammatory bacteria like your proteobacteria can increase, and this becomes a red flag for autoimmune diseases. Of course, the body's going through preparation for energy storage as well as immune modulation, which affects the gut flora. And we do see a huge connection in maternal gut flora and the baby's gut flora. So not only is it important for your own gut health, but also important for the baby's gut health to be eating well and supporting that. And it's more than about digestion. It's also super important for mom's postpartum recovery, resilience, and to support through the physical and emotional stress that happens in the postpartum phase. Postpartum. So mom gives birth. A lot of hormonal changes happen. Your hormones plummet as soon as the woman gives birth. And there's a lot of changes that also happen that changes your microflora. So when the hormones plummet, so does your gut flora, particularly LGG, so your lactobacillus rhamnosus, and your bifidobacterium. There's blood loss, which also affects your gut flora. Sleep deprivation, as well as stress, all those cause your cortisol levels to rise. And when your cortisol levels rise, there's a whole cascade of pro-inflammatory cytokines that come into place. Antibiotic use, so during either vaginal birth or C-section, this not only affects mom's microflora, but it can also affect baby's microflora. And we do see that whether mom gives birth vaginally or C-section can also just the method itself can start affecting the microflora of mom and baby. So of course, there's a reduction in the biodiversity in the gut flora with all these changes that mom goes through, and a dysbiosis potential, which means an unbalance in the gut flora. So mom gives birth and now there's an imbalance in the gut flora. What does this mean? What is this impacting? So there's emerging evidence that link your unbalance of gut flora to postpartum depression. So as these hormones plummet, your bacteria levels become unbalanced and come down. We do see that neurotransmitters like dopamine, serotonin, and GABA start getting affected. And those are your feel-good hormones. These are your hormones that keep you less agitated as well and less irritable. So of course, that starts affecting mom's mood as well as her food behavior. So we do see an increase in emotional eating as well as carb cravings. So already indirectly, we're starting to affect mom's weight management through the postpartum depression phase. There's also autoimmune flares that can happen. So as mentioned before, giving birth is stressful. There's physical stress, there's emotional stress, your cortisol levels rise. And when that happens, there's pro-inflammatory cytokine cascades that happen, which can cause autoimmune flare-ups. Your Treg cells, so these are cells that dampen those immune flare-ups and immune responses, all of a sudden reduce. So then mom is more at risk for getting things like lupus, rheumatoid arthritis, as well as Hashimoto's disease. And for many, many years, doctors would attribute that to just, well, you're going through all these hormonal changes, this is what happens kind of thing. Yes, that's true, but with these hormonal changes, your gut flora is severely impacted, which is leading to these issues. We also see digestive issues happen, so gut leaky syndrome. We see constipation, bloating, and a lot of discomfort. So a lot of moms experience constipation after giving birth, so that's not fun. And of course, impaired metabolism. So that's where the weight management piece comes in. So with the unbalance of bacteria also comes a disruption in your metabolism. There's calorie extracting bacteria, particularly called firmicutes. Their job is to break down your complex carbs as well as fiber. So when those get disrupted, we see that all of a sudden, mom is absorbing more calories from the same amount of food versus when things are nicely balanced. Not only is your metabolism disrupted, but we do start seeing more energy storage, especially around, or fat storage, especially around the belly area, the abdominal area. We see a disruption in your hunger and signal cues, so your leptin and your ghrelin, as well as your GLP-1 signals, so your satiety cues. So you're no longer satisfied. You just don't have that satisfaction. So we start seeing moms wanting to emotionally eat, comfort eat, and get more, almost like a dopamine hit from food because of that dysregulation. So there makes it really, really hard for moms to be able to manage weight because of all these neurotransmitter changes that are occurring in the background. Also, we also see that there's major impacts on breast milk. So when mom's gut flora is not healthy, when she's not eating well, breast milk does comprise probiotics and prebiotics in them. And if mom's not eating well, this affects the composition of breast milk because her gut flora is unbalanced, so is the breast milk. And this affects infant gut health. So we're in this situation, mom gives birth. What do we do to avoid all that? A balanced diet, super, super important. We do see that there's a huge diversity in gut flora bacteria when mom is eating a more diverse diet. So a bit of complex carbs, protein, fruit, vegetables, a little bit of everything, dairy. So more variety means more variety of good bacteria. Prebiotics, so fibers. These are fibers that feed your good bacteria. So we want to get more through garlic, onion, asparagus, oats, just to name a few. Probiotics, so fermented foods, kefir, sauerkraut, kimchi, those are all sources that we can get it from, and that's going to populate your good bacteria. Polyphenols, your omega-3s, those are anti-inflammatories. So those reduce the inflammation in your gut lining so that we can avoid these autoimmune flares that we can see postpartum. Now, there are specific nutrients moms postpartum do start lacking, like zinc, glutamine, and vitamin A. These are super important for your gut lining and the integrity of the gut barrier. So if we can get those in through supplements, I usually do recommend that. Vitamin D, very important for the immune system and your gut microbiome, but also it's a precursor for serotonin. So we know that serotonin levels can dip, causing mom to feel more anxious and irritated. So high vitamin D levels are important. B vitamins, this helps break down complex carbs, so helps with that calorie extraction. Super important for mental health and gut health. Iron, so postpartum, many moms do experience anemia. So of course, we put them on iron supplements. But what many women don't realize is that iron can disrupt your gut flora as well. The unabsorbed parts of iron will feed harmful bacteria, and they will reduce your good bacteria. And of course, we don't want that because that's then feeding back into this unbalance. So to avoid that, I always recommend moms to get a good source of iron supplements. So an iron glycinate, which is absorbed much better. You want to take it with vitamin C, again, enhancing that absorption so there's not a lot of unabsorbed iron left. And you want to make sure that you're not taking high doses that are not prescribed for. As a dietitian, I don't just give people a meal plan and send them off and say, hey, just focus on your diet and that's it. I always tell my patients, you can be eating the most perfect diet. If your lifestyle factors are not in line, you will not be able to achieve the results that you're looking for. You gotta be having good quality sleep. I know moms have erratic sleep when they first have a baby. Their eating behaviors are all over the place, which can affect your gut flora, even the spacing of food. But sleep quality, even fragmented sleep, is better than nothing. It's going to keep your cortisol levels nice and low, which means your inflammation is going to be nice and low too. Stress management, so whether that's meditation or breathing exercises, or even through exercise, physical activity, that will reduce the inflammation in your gut. And avoiding unnecessary antibiotics and anti-inflammatories. So I know sometimes there's antibiotics given as a precaution, as an in case, but if it's not warranted for, I always recommend for mom to not necessarily have to take it. Breastfeeding and the microbiome. So if mom chooses to breastfeed, it's even that much more important to take care of your own gut flora because how you eat will affect the composition of the breast milk and will affect the levels of probiotics like LGG and bifidobacterium in the milk. And skin to skin also promotes a healthy gut biome for baby. Even especially when mom has a vaginal birth, that is the most important time to do skin to skin, as they are getting a healthy gut microbiome that way. So sometimes diet is not enough. And if I have a mom that's still symptomatic, still feeling very lethargic, low mood, bloated, constipated, I do recommend that they do get on a probiotic, especially on strains that we do know plummet. So your LGG and your bifidobacterium. You want to look for a good quality brand. I'm not affiliated with these brands, but they do have good strains that we want to get. So that LGG, the bifidobacterium, so CDS01. I love this one because it's symbiotic. It has the prebiotic blend, so fiber. So if mom's diet's fiber is lacking, it is good to have this combination. The timing and the duration that you take these probiotics are also important. You want to make sure that with these strains in particular, you're not taking them on an empty stomach, as they are sensitive to acids, so you want to take them with food. And depending on how bad the symptoms are, you may take it for 4 weeks or maybe even up to 6 months. So it's important that you do understand how long you need to be taking them for. Very quickly, I had a first-time mom who had a C-section. She took antibiotics, and after birth, she was feeling very low mood, very tired, very bloated. And we decided to put her on a healthy diet, nicely balanced, high fiber. We did put her on probiotics as well. And within 6 weeks, her bloating was gone. Her mood had significantly changed. It was honestly like seeing a different person, and her energy levels were much higher, and she started feeling more like herself. We always hear moms say they just don't feel like themselves, and we constantly tell moms, well, that's a part of it, that's normal. But just like when you injure your knee, there's a whole protocol for physiotherapy. When it comes to postpartum care, it's super important that we are prescribing moms the right things so that they do feel like themselves right away. So this really, really highlights how targeted nutritional strategies can really make a difference in that postpartum recovery phase. So the key takeaways here is gut flora significantly impacted during pregnancy and mostly postpartum, so after pregnancy. Once birth happens, targeted nutrition is extremely important to rebalance the gut flora, and supporting the microbiome not only helps mom, but is extremely important for baby as well. And to always focus on a balanced diet, get those high fibers in, and the probiotics. And if you need supplements, that's okay. Thank you so much for having me speak today about postpartum and how important the trillions of bacteria is for that recovery phase in life.
Thank you, Sarah, for such an insightful look at how gut health continues to support us through the postpartum experience, a topic that we don't talk about nearly enough. Before we introduce our next speaker, I want to take a moment to recognize any healthcare professionals joining us tonight. If you're interested in exploring partnerships, educational collaborations, or how Gutcheck VIVO can support your practice, we invite you to fill out the Healthcare Professional Interest Form, which you can find, again, over at our table. Anyone else joining us tonight who's just passionate about women's health and education, we'd also love to connect with you. Now, please join me in welcoming Dr. Eddi Kenny, a holistic medical practitioner, researcher, and educator with over 30 years of experience in integrative health. Welcome, Dr. Kenny.
Where were you 30 years ago when I had my daughter? She blames me for everything. Not giving her sugar, and so it's great to be here, and I'm really excited to talk about how our microbiome is like a snowflake, because they're all different, and we didn't know that. We keep learning it, and we keep, now with the Gutcheck VIVO, we're going to test hormones and all kinds of things now, which gives us more insight into the body. So I'm really glad I have slides, because if anyone has seen me speak before, I can go down a rabbit hole really quick. And, it's my biome. There's trillions of them in there. So I take an approach like this as a naturopath. I started out as an oncology nurse back in the 80s, early 80s. I traveled through the US and attended lots of schools, and I'll give you the bio whenever you want. And most importantly, I love sharing information with like minds and empowering women. And as my approach says there, I tie together wellness, personalized wellness plans for people, lifestyle nutrition, stress management, everything focuses on you. So I'm committed to fostering an understanding among individuals that our lifestyle choices, when appropriately addressed, can have a profound and transformative impact on our mental and physical well-being. Our gut biome is connected. We have this brain and gut communicating all the time. The gut microbiome and our women's hormones are linked. Our gut health profoundly impacts our physical and mental digestion. We address the brain-gut connection, restore overall well-being, leading to improved health, balance, and vitality. So we have the unique snowflake, we have the unique microbiome. There is no two same microbiomes. One diet can work fabulous for one person and not for somebody else, as you know, especially in pregnancy. And then we go through perimenopause, and then we have menopause, and then we have postmenopause. And I've been through all of them so far. I wonder what's coming. What else is there? Poster? I don't know. So gut health matters. Our hormones and our microbiome affect our immunity, our sleep, our skin health, mental health, digestion. I can look at lots of faces out there now, and I know there's some microbiomes that have changed out there. I know. Mine continually changes. So we want to talk about how important it is that the gut and the brain, they communicate. The gut is often called our second brain. We've heard that before. How many times? I didn't hear it 30 years ago, but I sure have heard it more and more and more. And because it affects our digestion, and we know it affects hormones in the body, we now understand, and now with the help that Dr. Nikki and all these beautiful microbiologists have discovered, that we store some estrogen in the body, and we want to be able to access it. And we think when we're in post-menopause that we're done, our estrogen's gone, there's no more, but it's hidden. Oh yes, and we're going to find it. We also absorb nutrients through our gut, and food is not just food. We have to put good food in the body. And I go by the 20-80 rule, 80% good, 20%, not so good, junk. And you were thinking it was the other way, right? Because I said it backwards. I know you did. And our gut houses that microbiome. It's like our village. It's the village people in there. And they're from everywhere. They're from all over the world if you travel. We're picking them up and dropping them off from the time we came out of the womb, right? Your dog's licking your face, your hands are in the dirt, the baby's fallen, they're in the pond. We're building on the biome. And then we have this immune health, and we know that our immune health is really dependent on gut. Our metabolism, when we gain weight, lose weight, there's so much, it's all about the gut. And now the mental health aspect, there's so much mental health awareness right now, and newly diagnosed cases of ADHD and learning neurodiversity, all kinds of things. We need to look more at the gut. This is an amazing test where we can, get in there and this is science. So I love it. So symptoms of hormonal and microbiome imbalances. There's digestive issues. There's mood and sleep disturbances. There's frequent infections. People get coughs and colds, and we keep taking these antibiotics, and people are getting antibiotics for viruses. You can't treat a virus with an antibiotic. So we often have to find other ways to do that. Joint pain, inflammation. We get the itises. Everything that ends with an itis. So bronchitis, sinusitis, tendinitis. My mother goes, "Oh, Eddi, I am 90 and I have another itis." I said, "What is it, Mother?" "I have fasciitis." "What the heck is that?" I was like, "I'll tell you later." Too much information, Mom. Fatigue is related. Food intolerances. People go, I can't eat anything. They come in to see me and I'm going, you're allergic to 20 or 30 foods? Really? You're allergic to them, you know? And then it's shrimp one day and it's not shrimp the next, and it's dairy and it's gluten and it's, so I love the gut check because it really helped me. It aligned really well in my practice because we can look at the foods that agree with you. And now we can look at the hormones and how it's all affecting each other. So skin problems are even, you know, linked to what we eat. The skin is a big filtering system. It has to get the stuff out. So a lot of times you'll see your skin improve, shiny skin, and it glows. And people say, I've lost my glow. I said, well, let's go find the root. Let's see what's going on, why it's not there. What are you eating? What are you eating that you shouldn't be eating? And there's more, right? There's not more than just food, but we can start there. Also, our immune systems get weakened, and a lot of times people end up with autoimmune conditions. So, and a lot of times they get a blanket diagnosis like IBS. Oh, what's wrong with you? I don't know. It's IBS. And then there's a medication, and IBS is irritable bowel syndrome. Tell me what you're eating, and let's see if we can get rid of some of this irritation. And weight changes after that. A lot of times when you take inflammation down, weight decreases as well. Huh, who knew? It's the biome. So I tie in the hormones to the biome as well, because as we get older, and we got really afraid of estrogen. I remember when we were working I worked in the breast cancer clinic in Vancouver, and estrogen was like, the fear word. And now that we know more in science, it's like, we need estrogen. Our brain uses it, and our ovaries secrete it, and we get it now in our intestines too. But it has to be reactivated and reabsorbed by the enzymes that all these microbiologists know how to pronounce really well. And they'll tell you what they are, because I know my lane. So these are the phytoestrogens. So we get these plant-based compounds and seeds, you know, flax seeds. Well, people go, well, flax seeds are good, and I just throw them in my smoothie, or I throw them in, you know, yogurt. And I'm like, well, you got to grind them first, because, you know, they can go rancid when they're sitting around and they've all been activated. You want to grind them and use them at the same time, not just take them, grind them for the week and then throw them in, because they're losing all that nutrient. Your nuts, almonds, walnuts, pistachios, legumes, lentils, chickpeas, beans, and soak them. If you got one of those guts that you're like, oh my God, I can't eat beans. Oh, gas. Well, where's it coming from? There's boys in there. There's small chain fatty acids. They are like that. They have that for a snack before they feed your bacteria. Like we got to know the process. And when we know more about what our gut's able to handle, we're able to tolerate these foods better. And sometimes they need help. The gut needs help. It needs a probiotic. It needs a digestive enzyme, or it just needs the right kind of food to go in your gut, right? So we also get some vegetables here, carrots, yams, alfalfa sprouts. So some of these foods, when you're postmenopausal, you really want to eat them, right? But if you have estrogen dominance in your family, maybe you don't eat so much of these. Choose the other things that, you know, the other kinds of beans, and decrease soy. But if your estrogens are going down, now's the time to play around with some organic soy, whole grains, oats, even fruits and berries have beautiful compounds in them to help your gut, because it's not only giving you a little bit of estrogen, it's also feeding all these other little bacteria that are feeding each other. Like we're going around with a fish tank in there, you know, it's amazing. So why do we shift? I'm going to take water and give my biome a little drink, because it's a bustling city full of tiny inhabitants in there. So I've witnessed many people experience significant health improvements after they change their diet, and it's even the slightest change. The impact of a healthy gut microbiome on your overall wellness is profound. A high fiber, plant-based diet increases your beneficial bacteria. And there's your short chain fatty acids, the little snackers. That production, it's essential for digestive health. Diets high in saturated fats, like a lot of animal protein, processed foods, takeout, fried foods, they decrease the really good bacteria, like the bifidobacteria and lactobacillus, which a lot of times you'll see those two on a probiotic. And then there's a bunch of other ones named, and there's 12 strains of those. And it's really helpful if you know what your gut needs, isn't it? Like, especially, and if you do a gut check and it says you're missing these, I'm like, okay, I'm going to believe them. I think I'll do that. So we don't want to increase our harmful bacteria. We want to increase our beneficial bacteria, because women's health and your microbiome is like a secret code that regulates our bodies. And we never discuss the microbiome. I have a friend in Nashville. She's a vascular surgeon, and she looked at me 20 years ago, and I thought gut flora was everything. I thought everybody knew your gut health was really important. And I guess I thought it because 30-something years ago, I was diagnosed celiac, and I lived the first half of my life not knowing it, and a ruptured appendix and bowel issues. And I'm going, everybody knows the gut plays a part, but no, we don't. And women's health is coming to the forefront because there's more women in medicine these days, and more women are speaking and talking about their guts. There's a lot of shit in your shit. So menopause and our belly shapes. Oh my God, how many times do I get asked, why am I getting a man belly? Why am I getting a man, like estrogen dominance? I'm like, oh, it's estrogen. It's that storing, it's our microbiome. It's where we're storing things. We don't want the man belly. Those sudden changes, it's an estrogen issue. And if we know what's going on in our microbiome, we can shift and change that. Understanding the science. For years, this was just accepted as a natural part of aging. Now we're starting to understand the science behind it. Estrogen in the intestines? Who knew? Now we know we can have a little bit of access to it. Who knew? So I tell my clients, don't tattoo, pierce, or divorce anything until you're back in balance, because when your hormones are out of balance, look out, because it's dangerous. I mean, look, how are you going to explain that tattoo years down the road? Like that one you got when you weren't. I don't know what I was thinking. Well, we weren't. And also our emotions get all out of whack as well, because we think it's mental health issues, and a lot of times it's a hormonal issue. Low progesterone, low testosterone. It's really important. Cortisol, high levels of stress hormones. We can eat great and exercise, but if you're stressed out, you got to manage that as well. And like you had said earlier, mindfulness techniques, meditation, walks in the park, nature, shut it down. We got to be able to calm it, because the brain communicates to the gut continuously. It's like your mother-in-law all day long. What do you need now? They do. And if they're communicating, it's a really nice transition. It's easy. But if the brain and the gut aren't communicating, it's not fun, is it, guys? I've been there. It's like, oh my God, we lose our patience. We don't have compassion. We get compassion burnout. There's so many things happen. So we want our brain and gut to be really in tune. It's like a good team. Can changes in the gut microbiome affect mood in women of all ages? Yes, from 0 to 100 and 100 plus. The gut microbiome regulates estrogen levels and produces mood-essential neurotransmitters like serotonin. It's secreted in the gut. And on the gut check, it's on there. It measures. We see it. And I'm going, oh, that's why you're so happy-go-lucky. You have a lot of serotonin. Oh my God, look at your husbands. Oh, we should work on that. Here's a little bit. I love when they come in and they want me to read their gut checks together. I just have so much fun. It's like, it makes me want to have a glass of wine. No, I'm kidding. So there's hormonal fluctuations, particularly estrogen drops. They disrupt the gut microbiome and they affect your mood. Compromised gut permeability leads to inflammation, which is linked to anxiety and depression. There it is. Certain gut bacteria release toxins that negatively impact mood and trigger cravings for unhealthy food, creating a cycle of imbalance. So you go, I just can't stop eating. I crave this and I crave this and I crave this. This sugar, 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 because we're feeding yeast and yeast wants more. I mean, your yeast can see the Kit Kat bar from the back of the store and you're not even out of the car yet. Like it's right. It's crazy. So that's what happens. And it's okay. I get irritable sometimes too. That's what the brain says to the gut. And that's emotional well-being. It's really important that we get these two communicating. We have this beautiful big vagus nerve. It's like a train station in there. And it's communicating all the time. So I've been through it, like I said before, from menopause to from the start of the menstrual cycle through pregnancy, through all the way to postmenopause. And there's this mood stuff that happens. When we feel good, we eat good. When we feel bad, we eat bad. It's like when the gut is healthy and happy, we seem to be that way too. Like we go around bloated and bleh, and in our mind, and we're like, we're not in the mood. I'm just not in the mood. So great that people can work from home today too, isn't it? It's like, I'm not in the mood to go in. If I look at somebody, so turns out that what we eat and do does have a big impact on our mood. And these things, that happen, these changes can happen even after menopause. Estrogen, we can have a 70-year-old whose estrogen can drop and they're like, why am I having hot flashes? I'm like, oh my God, your body found estrogen somewhere and lost it again. Let's search. Let's do a search for that. And we talk about, I mean, we could do a whole other talk on hormone replacement therapy for men and women, but that'll be on another time. And when we say, these changes affect men, yeah, there'll be a gut check for men, I'm sure, at some point. Health is wealth. In a world where you can be anything, be yourself, like your little tiny microbiome. Thank you. Thanks for listening. And you're welcome to ask lots of questions later. Okay.
Thank you, Dr. Kenny, for reminding us just how individual and dynamic our gut microbiomes truly are. Again, just going to let you know, if you haven't yet entered our giveaway, if you're online, you can scan the QR code, or you can visit the welcome table over here to the right if you are here in the room. Next, we are going to be joined by Jenny Bihari, a certified nutritional practitioner and women's wellness coach known for her holistic, empowering approach to healing. She's actually going to be joining us virtually from Ottawa. So if you'll just give us a minute to switch our screen over so that you can see her and her slides. Perfect. Not even a minute. Please welcome Jenny.
Hello. Hi. So I wish that I could be there with all of you, but I'm not. I'm here in Ottawa. So I'm so excited to be sharing this with you today. I definitely want to be able to go through a bit of this stuff, not as in depth as we could go into it because there's so much more, and I know that everyone feels that way as well because there isn't that amount of time because I could talk about this forever. I could talk about gut health forever. So I want to talk specifically about the female lifespan and some of the places where we start to see some changes, but like it does start at the start. It starts at youth. So we'll be looking at the importance of that and what changes that we can make. So I work with a wide range of clients. So I do work with young people. I work with a lot of teenagers, specifically with eating disorders. I work with many women dealing with fertility issues, perimenopause, menopause. Also remembering that menopause is just one day. A fun and crazy fact about that menopause is in some areas, some regions of the world where they're not necessarily living more of this like westernized living that we're living. There is just the menopausal day and there isn't the same symptoms that we experience here with hot flashes, issues with, like not feeling really good, mood disturbances. They just aren't as severe for people in other countries. And then, of course, we have postmenopause. So one of the biggest things that I see here is that bowel health is often overlooked. This also comes from lots of people that have been in the workforce for a really long time, and they sometimes do not go to the washroom at work. And then it leads to a lot of issues once they retire because they've been holding it in for so long. So that's one thing that I definitely see as an issue for some of my clients. And I work with them to make sure that we're getting that sort of back into more of a balance that they should have had before. So when you're thinking about all of this, like this lifespan of our overall gut health, like there are different things that we're eating throughout these times, different things that are going to affect us, and also our family's eating habits affect us long term. So when you're looking at youth and puberty, I mean, a menstrual cycle does take a lot of time to regulate. So there are painful periods, and then this can be part of a hormonal imbalance. But what I do see a lot is the birth control given to younger women when they start to get these issues, but there isn't any look at any of the other factors that might be affecting this. There's a low energy issue, so like nutrient metabolism and absorption. So I have teens and youth that come to me that don't have a lot of energy, and they're like 11, which is just a little bit insane to me because they're so young. And I think like, oh, you could be more lively than this. Some mood issues. I don't know if anyone is close to a preteen, but that is the meanest stage. It's so mean. And I realized that I was also mean there too, and there was definitely some imbalances going on there. Poor sleep, so staying up really late, also not necessarily like taking care of your body in the same way because you just don't know and everything's really new to you. And then also like some earlier periods, so not necessarily really knowing how to take care of your body when you first get a period at maybe 11. And then a lot of the time, it is a low fiber and nutrient void diet that doesn't support your microbiome when you're that age. It's not something that, and yes, parents are working very hard to make sure that their kids are eating properly, but it is also difficult when they're also hanging out with their friends a lot. So our menstrual cycle does require a proper hormone metabolism to work properly. So one of the craziest things is that it takes a really long time for your menstrual cycle to regulate. It can take 10 to 12 years. So menstrual cycle, it does take 10 to 12 years to regulate itself. It does affect our growth. And how we eat does affect this. Also, if there's any sensitivities or any food sensitivities that happen during this time, that can also start affecting your gut. So I know that our last two previous speakers were speaking about how this affects us. And I also have celiac disease, and I did not know. And I ate gluten for a really long time, and it does affect my overall gut health. And I did do a gut check, and I looked at it, and I was like, okay, wow, that is. I've had clients do it as well, and they are doing better than me because they also, compared to what their absorption is of other nutrients, where I have a more of a permeable gut because I did unfortunately eat gluten for way too long, and it was something that wasn't right for my specific situation and my body. And then looking at the habits that are being formed. So I formed those habits. That's just what my family was eating. We were eating home cooked meals. We were an ingredients house, but I was eating like baked breads, and I was eating like flatbreads that were made. So, and I didn't know. I just didn't know at the time. So looking at those things of what you're eating now, and like paying attention to what those sensitivities are, because sometimes we just don't know what that is. Is it a skin issue? Is it a hair issue? Is it a bowel health issue? And a lot of the time people are a little bit embarrassed to talk about that, but I'm always like, tell me more. And no, you can never give me enough information. I always want to know a lot. So here's our lovely female menstrual cycle. When you're in these cycling years, we have our menstrual phase, which can be sometimes a relief for people depending on like where your hormones are at. Then you have your follicular phase. So again, the menstrual cycle, typical menstrual cycle is 3 to 7 days. Our follicular phase is like after our periods, and then it is about sometimes like 7 to 10 days. And that's often when we are feeling a lot better after getting out of a menstrual cycle. I will say that don't let your follicular self fool you into thinking that you're going to be a social gal in luteal phase. And follicular phase, you might be like, oh, I want to hang out with people. I'm going to make plans in 3 weeks. And then you might be in your luteal or your menstrual cycle, and it's not going to be super fun. And this happens to myself and other clients included. And then you have ovulation. It's a very short time period, but it also is when you're most likely mood-wise to be the most confident and also feel like never have you seen such beauty. It's my favorite phase because it's also when you have feels really good, and the hormones at this stage are wonderful. And then we have our luteal phase, which can be our PMS symptoms. There are many things food-wise that can be included or excluded from the diet that can help for some people. And I will talk about it later when we talk about perimenopause. For some people, they find that like avoiding more refined sugars around this time really like helps them with their overall mood balance. They find when they do an increase in protein during this time, it helps them with their excess hunger, and especially if they do increased fiber as well, because sometimes the luteal phase can like shut things up from a bowel health perspective, and you don't get as much of a loose stool as you might in your menstrual cycle. And that's just the prostaglandins from your period leaking into your bowel and then making you have like some loose stool. So a really not so fun fact that I learned from my naturopath, who is a man, is that periods should be low to no symptoms. And this was like when I was like a baby nutritionist and didn't know anything. And I remember looking at this man and thinking, sir, you're absolutely wrong. There's no way. There's no way. And it was years ago. It was a long time ago that he told me this. And then I realized that it was true. And I also can live a life like that. And I have clients, myself, and friends and people that I really care about that do have better menstrual cycles just from changing some of their dietary things and including certain things into their diet. And looking at some of the other things that are included in this dysregulation of the gut are some other symptoms that I do see in people and other conditions. So endometriosis, sort of dealing with the severity of perimenopausal symptoms. One of the biggest perimenopausal symptoms that I'm seeing is like a lot of mood symptoms. I do have clients that will just say when they come to contact us, they're like, I am truly trying not to get a divorce. That is like one of the biggest things that I hear, because it is a mood imbalance. You're also in that perimenopausal era and menopausal era. You might be like sandwiched in the middle. You have kids, you have aging parents that you're taking care of, you have a family, probably potentially getting more responsibilities at work, being asked to do more, being asked to do more management, things like that, because you've been working this job for a long time. And like sometimes when you feel like you can do it with your eyes closed, suddenly that feeling goes away. PCOS, polycystic ovarian syndrome, which they're changing the name of quite often. That's what they're starting to do, because it isn't just about the cyst, it's about the other issues that happen with PCOS. There are also certain types of PCOS. So some are, often you do see the one that is a sugar issue, a sugar imbalance issue, but there's also ones that are post-pill, so right after after getting off birth control. I've seen this before when people are trying to get pregnant. There's adenomyosis, which is different from the endometriosis, so it's more on the outside. And then you've got also cysts on the inside that are fusing things together. Constipation, again, like constipation as a dysregulation, I think that people accept far too much as not being an issue. Clients will tell me that they haven't gone to the washroom in like 4 days, and they're like, that's just me. I'm like, oh, okay. If it's going in, you got to get it out. And I think that that's been said already. Our other autoimmune conditions, I've seen Addison's disease, Hashimoto's, fertility issues, and then of course our mood and our energy. So the feelings of good and bad as well. And then here we want to make sure that we're looking at our skin health and our hair health. That's another way of seeing like how well things are going. So a lot of people are looking at this from a vanity perspective, but it is really an overall indicator of health. Your body will take nutrients from other places in your body to like make sure that you are still surviving. So there's thinning hair, brittle nails, dull skin, changes in a skin reaction or more sensitivities related to certain things. So I also have seen people just getting rashes more often, especially when they're starting to make a dietary change or after prolonged antibiotic use. I've seen that as well. And then the poor absorption of those nutrients just that I spoke about are still an issue, and there are things that will probably affect people long term, myself included, as I do not have the world's best absorption, but I work really hard to do that. So bowel health is deeply important, as I just said. So our daily elimination is so essential for the hormone metabolism to be going in. It's essential for weight management. It's essential for proper mood. It's essential for just feeling good. Like if you're full of poo, I don't really think you could feel great. A quick little note about fertility I know is spoken about first. A healthy microbiome, just as was said, will encourage your fertility, and stress does affect this. So like thinking about how stress affects our gut. And I know that I've had clients come to me that are dealing with infertility, and then they're just like, everyone just tells me not to be stressed. And it's really difficult to do that when that is it was a big thing that you're looking to do. But also, if you're feeding your microbiome and feeding your gut in the right way, the chances of this being a good outcome are a lot higher. And then getting into our perimenopause and postmenopause. So our bodies are more inflamed at this time, and then there could be poor gut health also at this time. It leads to worsening symptoms. So there's a lot of leaky gut. So I always tell everybody to look at their hands. And everything should be closed like this, but then this is sort of what's happening with a leaky gut. Some stuff is going through. A lot of our neurotransmitters, as you know, are made in the gut, and they do help with our mood and sleep. And then you'll get some digestive issues if things are not working properly. And there's also a lot more sensitivities at this stage. I will see people that have been eating certain foods forever, and they'll say like, they're like, I don't know what it is. I've eaten this forever. And I'm like, things are becoming more permeable. You're under more stress. You've lived a longer life. There's lots of changes that are happening within our body. It's so nice that we're actually able to study them. So there is a lot of weight gain that can happen during this time, and muscle loss, specifically if you also haven't necessarily been building your body in this way that you're used to, of having, of like lifting weights later in life. Whereas like sometimes now it's starting to be spoken about a lot more. So this is just a quick case study that I'll go through right now of like how we sort of put this into practice. So this is a case of a 39-year-old dealing with early perimenopausal symptoms. I've seen these happen at 35. I've seen them happen at 34 for some of my clients. So for this person, it was a mood, weight gain. She had some skin changes, fatigue, and a lot of impatience with her family and her husband. And we've had many discussions about how difficult that piece of her life was. And while our time together, she said that one piece, yes, she lost weight, yes, she gained some muscle, but the most important was that she was actually able to just work and show up and be there for her family and not be so angry all the time. And that was like a really game-changing thing for her. So dietary changes we avoided dairy 7 days before the expected menstrual cycle. She's still getting a normal, like on time-ish menstrual cycle from the 29 to 36 day sort of menstrual cycle. We also stopped alcohol consumption because it was sort of fueling some of her symptoms. It can compromise your digestion. Basically, it's like you're washing away all your good bacteria sometimes, and it can increase some of the estrogen-fueled symptoms. So like crying and everything, that's very cute. There was also the avoidance of refined grains 7 to 10 days before the cycle. So like pastries, donuts, things like that, but then leaning into things that are more full. So like was having oats with like some honey and berries and Greek yogurt in it. And that sometimes helps her a little bit. And then she would switch to coconut yogurt and use a plant-based protein powder. The lifestyle changes that were made were not to overcommit. So instead of saying that she's going to do this and this and this and this, it sort of just made things a little bit lighter. And then also talking to her again about not making plans in the follicular phase, thinking that she'll want to do them in luteal. So her main results were more patience with her family, just like a shorter period. The duration varies a little bit, obviously, because it is perimenopause. So I don't want to specifically say that it was because some of the changes that we made, but it also just was less intense. There was no bleeding through anything. Breast tenderness was gone. There was no acne, and weight gain and water retention was 60% eliminated. We do body composition testing at my office, and during menstrual cycles, a lot of the time I just tell people that we're not going to do them, but I sometimes look at the numbers to say like, okay, like you are retaining water and your muscle mass has gone down and these things have happened, but then as soon as they hit their follicular phase, their results are a lot better. So those are just some of the changes. Thank you so much for having me, and I hope that you learned something today.
Thank you, Jenny, for reminding us how healing can be both personal and powerful. To close our speaker lineup, we're going to be joined by Dr. Nikita Kandiala, co-founder and CEO of Nucleic and the visionary behind Vivo. She's a researcher and entrepreneur whose work is focused on bringing cutting-edge microbiome science to real-world applications. Please welcome Dr. Kandiala.
Thank you, Cassie. Hello, everybody. It's nice to see familiar faces and a lot of good energy here. And yeah, welcome to this wonderful night for the launch event of Vivo. Cassie has introduced me, but I think I'll just give a brief of why we have started the microbiome testing. So it has a very personal touch to it. We have learned about how gut is very important from my mother's journey, who went through a cancer treatment and tuberculosis treatment. She is no more, but then she left her personal journey with me. So trying to understand how gut health is so important, how antibiotics can destroy your gut, your appetite towards your health, your diet, and the life around you. So this is where I am, bringing this purpose to everybody, and it will continue to give the insights and a more empowering knowledge to support every individual. So no more delay on further what I'm going to speak today. I will thank my fellow speakers. They did an incredible job today of correlating how women goes through different life stages and how hormones contribute towards those. And of course, the gut and the diet has a very big role to play. So I will dive deeper into how this microbiome is contributing towards the various aspects of the women's health, and then we'll see how we can take control over with this Vivo product. So microbiome, we have been hearing this word at least since last 1 hour. So let's see what this microbiome entails. It's very much there. So microorganisms are very much there. They came before us onto this earth, and we are trying to live according to them in true words. So there are trillions of these microorganisms that are present in and on us and around us. What are these microbes doing? So these are microbes that are impacting in day-to-day life by contributing towards health and disease. And microorganisms like viruses, bacteria, and fungi, archaea, constitutes the microbiome. 90% of this microbiome is bacteria. And last 2 decades, science has advanced so much in trying to understand how this microbiome is contributing towards the health and disease intricately. Gut microbiome mainly because, as I said, 90% of your microbes in your body are residing in gut. And they're introducing this outside world through diet or the drugs that you take or the exposure that you have, and introducing it to the inside world of organs and the systems that you have. So let's start. Let's see how this microbiome is introduced to us. It starts right at the conception of us in our mother's womb. So Sara did a great job in introducing how it's contributed in the pregnancy or the postpartum. But it's very essential that what a mother's diet is, or how the child is born, whether it is through the vaginal delivery or through the C-section, or what was the birth weight or the gestational age of the child. And more so to it, after the delivery, this child or the baby, how they are fed, whether it's a breastfed or the bottle fed, or what types of food they are exposed to and what type of environment they are exposed to, that forms a seed of our microbiome. So this seed of microbiome has shown that, the research has shown that an individual can handle a long-term health or disease based on the seed microbiome. What are the other factors that contribute towards this microbiome over the different stages of humans is the diet, medications. For example, you were infected and you had to take antibiotics, or you had some disease like cancer, you had to take chemo, or the lifestyle changes that you do. So all of these factors impact your microbiome, and it's essential to understand what's happening inside. More so to it, as women, we are slightly different. So what makes the difference? There you go. We've been hearing this, hormones. Especially estrogen and progesterone, that indicates which life stage and what you go through, whether mental or physical changes that happen at different stages of life. So at puberty, we have this influx of hormones to support the sexual maturity or the physical changes that we go through as at that age. And post that, during the fertile years, the reproduction or that phase is being handled with these hormones. And in perimenopause, we are in the process of withdrawal. We can say it's a reversal of puberty, but not truly. So this withdrawal of hormones will lead to, again, first time I heard about the menopausal symptoms from my neighbor, I think she is here, about what night sweat she experienced, Janet. Night sweat she experienced, or hot flashes she has, the urge to scream on her husband. So it's really true, and then it's very essential to understand what's happening. So now it's not a taboo. We are speaking about it. It's excellent that we are speaking about it. We are learning about it. I haven't ever heard from my mom if she ever went through these symptoms. She passed away when she was 54, but I've never known if she had any of the menopausal or the postmenopausal or any perimenopausal symptoms. So it is very important for us to talk about these symptoms or what we go through as a woman and educate ourselves to balance ourselves. So this hormonal changes not only impact the outside of the world, but also the inside as the microbes. So what is necessary in this microbial world is the balance. So what decides this balance of microbiome is the diversity. So when you have different types of bacteria, more the different types of bacteria, it's considered as a higher diversity. And less number of or different types of, less types of bacteria, it is considered as a lower diversity. Let's take tropical forest and the desert. So if a soil is very healthy, which means your gut is supporting that, you can accommodate different types of trees, plants in that soil. In the same way, you can accommodate a lot of different types of bacteria in your gut if you have a higher diversity. If you have lower diversity, where the soil doesn't have that energy in it, it can accommodate only 1 or 2 plants, so very less number of bacteria in case of your gut. And if you have a higher diversity, this constant research is indicating that it supports a good digestion. It supports a strong immunity. It also balances your hormones. But then when you have a lower diversity, all the diseases show that the humans who have lower diversity are related to these diseases, whether it's obesity, allergies, I'm just naming a few here, brain health, and the hormonal imbalances. So what indicates or what leads to the lower diversity? One major factors could be the genetics itself, but then the other important ones are poor diet, lifestyle changes that we have, antibiotics, the medications like chemo, or the alcohol that contributes towards the lower diversity. So this lower diversity can regulate your microbes. In what terms? I'm just taking estrogen as an example here. So the bacteria, the types of bacteria that regulate the estrogen metabolism in gut are called as estrobolome. And when you have a balance in this particular estrobolome, you're able to regulate the estrogen levels. So our body, when we have a higher estrogen levels, it just pushes all the estrogen towards the gut. And if you have a balanced microbiome, you can manage these estrogen levels in your gut. So if you have a healthy microbiome, this excess levels of estrogens can be effluxed, that is, it can be excreted out. But then if you have an imbalance or a lower diversity, this estrogen is reabsorbed into the body. So when you have increased estrogen levels and there is an increased bioavailability of estrogen, it can lead to inflammation. It can lead to dysbiosis in your reproductive system, which can lead to vaginal bacterial vaginosis, or the UTIs, that is urinary tract infections as well. And the other aspect that it will impact, that is the huge connection of gut-brain, your mood, your stress management, your anxiety, all of those are impacted by the levels of the estrogen. So what I'm trying to say is, if you balance this particular estrobolome, you're able to balance the estrogen levels, how they are maintained. So the lower diversity, we've been just hearing from our fellow speakers that it contributes to various levels or the stages of women's life, whether it's a menopause, whether through the menstrual cycle, or through the reproduction or the fertility. So apart from these aspects, microbiome is also contributing towards autoimmune conditions, the thyroid function in itself, gut in aspects of how it is maintaining the gut lining, which can cause to inflammatory bowel syndrome or the inflammatory bowel disease, and osteoporosis. The gut brain, yes, we cannot avoid that. We've been hearing that in the past 1 hour, that it contributes to how active we are, how energetic we are, how our depression is managed, or how anxiety levels are known based on your microbiome. And also postpartum depression, as Sara has just mentioned. And science is emerging to show that these microbial levels can lead to reproductive cancers as well, like ovarian, different types of breast cancer. So how do you know that there is a dysbiosis? How do you know there is a lower diversity? How do you know there is an imbalance in your microbiome? How do you know the root cause? So we are testing the levels of whether it's the hormones, whether it's the vitamins, whether it's the hemoglobin. So those information is necessary. But the root cause that is lying in the gut, just to get a picture of what's happening in the gut, we are yet to know. So I introduced Gutcheck VIVO, which helps you to understand what is your microbiome diversity and what types of beneficial bacteria you have, and what is the pathogenic or the inflammatory bacteria that is present, and how you can correlate this with the hormonal imbalances. So how do this test work? So it's a stool test again, because the closest in your gut is stool. I know it's shitty, but then, if you want to see within yourself, that's the best way to look at. So when I say identifying imbalances, what does it mean? So I've talked about the estrobolome. So we'll be able to provide how is the estrobolome diversity is, and how it is impacting the levels, whether it's the low levels or the higher levels of metabolizing the estrogen, and how you can manage the estrobolome in itself. Apart from that, the insights on gut-brain. So as we heard about cortisol is one of the aspects which is regulated by your microbiome as well. And the serotonin is the other hormone. It is also called as a happy hormone. 90% of your serotonin is produced by your gut bacteria in the gut. And this helps you regulate your mood, your stress management as well. And the other insight we'll be providing in this report is about how the gut microbiome is contributing towards the thyroid function. So there are MDs in the US that are using the microbiome knowledge to regulate the thyroid function. So how the T3, T4 conversions are happening, how the microbiome is able to contribute towards the hypo or the hyperthyroidism. Of course, we cannot avoid thyroid when we are talking about the weight management or the metabolism. So we are able to provide the ratios of certain bacteria like Firmicutes and the Bacteroides, which helps you understand how are you able to manage your weight. So based on certain increase or decrease of bacteria, you can see we have both cases. Like you're able to either not decrease the weight at all, or you're not able to gain the weight. So just by looking at the certain microbes, we are able to tell that. And of course, the mineral absorption. If Sara just mentioned about the increased diversity during the pregnancy, so which reminded of myself. Of course, I didn't know about the microbiome at the time. So I was anemic before that, and I was going through severe low levels of the iron. And during my pregnancy, I saw that it improved. It was like magic. And then now I can see how the science is coming together. And I see that increased diversity, of course, supports the absorption of our minerals as well. And absorption of minerals also contributes towards your thyroid function, your weight management, and metabolism. Of course, the skeletal-muscular aspects, how it is managing the building of muscle strength, and also the physical endurance. It's funny that your bacteria can decide if you're able to run or not. We are able to indicate that your levels of cardio capacity as well. And the important aspect of the gut is the gut lining. Your microbes act as a guardians maintaining the mucin, that is the gut lining layer. Some of the bacteria like Akkermansia, they feed on the damaged layer and then also form the protective layer in the gut. So this protective layer is necessary to avoid inflammation, is necessary to communicate with your immune cells. And also, this contributes towards the health of your skin, whether the diseases like psoriasis, eczema, acne, they're all correlated to your gut microbiome and what's the composition or the diversity of it is. And not to forget reproductive health. So when I say reproductive health, it's mainly around the menstrual cycles, whether you are in premenopause, that is right after puberty, to before the perimenopause, and the perimenopause to postmenopause. So this report has two versions. One is to address the premenopause, and the other is to address the menopause and the postmenopause. Women that go through different symptoms, and how can you handle these symptoms by looking at your microbiome. So how are you going to do this? By introducing the personalized recommendations based on your microbiome. So this allows you to understand what is required in your gut and what is that you have to address based on the microbes that are lacking or the microbes that are present in excess. So balance is key. And to take control of your microbiome, looking inside through Gutcheck VIVO definitely helps understand what types of fiber, probiotics, or the polyphenols are necessary. But more to it, as we just heard, it cannot be just that. We have to focus on our mindfulness, how we are able to manage our mind, because they are always, gut microbiome is always talking to your organs, whether your mind or whether your hormones. So it's a reciprocal effect. And we see gut microbiome as a measuring tool. So we are able to see inside using this measuring tool. And if you have to, in life, we go through different life stages. And if you acquire an infection, you had to go through a disease, you have to take the treatment. That is very necessary. But then we have to also understand how to manage that post the treatment. I've seen several people who went through antibiotics. They either lost their lives or they went the degradation of their health. So it's very important to manage that post the antibiotics. If it's necessary, only take the antibiotics. And if you're taking the antibiotics, understand its consequences. So with all I can say is with Gutcheck VIVO, we are introducing a tool that will help manage the symptoms and improve the brain health and also our mental clarity. So with this, I would say that Gutcheck VIVO will help every one of us here to understand the hormonal imbalances through the gut microbiome and how this personalized diet can help you to regulate that. And our journey towards the optimal well-being begins here. Thank you.
Thank you, Nikki. And a huge thank you to all of our speakers tonight for the knowledge and inspiration that you've shared. We're now going to do a big Q&A session, so we're going to invite the speakers back up to the stage. And then if you have a question for any of our speakers, you can raise your hand and we're going to bring a microphone to you so that the people online can also hear you.
This might go viral. It's all about the microbiome. Just had to say it. Questions? Yeah.
No.
Nope.
Can you hear me? Yeah. My question is for Dr. Nikita. How much would you attribute the percentage of your microbiome to genetics versus environment? And how much can you change from your genetics?
That's a very good question. So through genetics, what we acquire, it's a very stable thing. We got what we got. So we just got, but then the microbiome is a dynamic aspect which changes through life. And then you can keep track of it every phase of your life to look back what's happening within you. So as I say, the genetics is stable. The microbiome is dynamic. It's changing. So you will be able to understand based on the microbiome condition, and you can correlate. So the microbiome is constantly changing until you die. And every phase, whether it's men or women, they have different kind. So even in the identical twins, only 30% of the microbiome is similar. So it's very unique. It's very personalized to you. So it is very essential. It becomes very essential to look at that aspect. So yes, yeah. I hope it addressed your question.
Yes, thank you.
Yes, Susan.
It's on? Okay. Hi. Since it's always changing, the microbiome, how often would you recommend like checking in on it and taking a look?
Yeah, that's an excellent question. So it's not a one-time thing and go, right? So we suggest to do this 6 to 8 months, the testing. As the change or addressing your microbiome itself, we give 3 months roadmap. So post this report, once you get the report, we give a 3 months roadmap of understanding how to set your soil by introducing the prebiotic foods and how to introduce the probiotics and what you can do about management. So yeah, it takes, we say every 6 months you do the test. So yeah.
We got a couple of questions online here. Kathy's wondering, how do we restore after taking antibiotics and how long does it take?
Yeah. Do you want to address that?
I'm sorry, what was the question?
The antibiotics.
How do we restore after taking antibiotics and how long does it take?
Well, that's a big question because it depends on the antibiotic. And yeah,
Course of antibiotics.
yes, yes,
How long it is.
yes. So the course of the antibiotic, how long the person's been taking it, the type of antibiotic, everyone's different. And when someone comes to see me, like even my own experience of childhood was a ton of antibiotics to treat from acne to gut health issues. And so that just wipes out your gut flora. So to restore it, we have to, in this time and age, to restore is to, start adding in the beneficial bacteria. So a lot of times with my patients, they are identified on the gut check, and it makes it a little more accurate, don't you think, to add in those particular lactobacilluses or bifidobacteriums and the Akkermansias and all the microbiologist language.
Yes, that's very true. As Eddie just mentioned about the duration of the course. So if you have to take the antibiotics over a year, and also how many different classes of antibiotics are you taking? Is this the simple course versus the very complex course, right? Because if a TB has to be treated, especially the XDRs, which are very resistant bacteria, right? So for that, it's a very it damages your gut tremendously. So sometimes it goes to a stage that it cannot revert back. So it completely depends on the course and the duration of the antibiotic that you have been taken and how fast you realize that you have to support that antibiotic treatment with the diet or the probiotics as a balance.
And also the age.
Yes.
The age is really important because you get a lot of seniors on antibiotics and there's bone loss and there's, they get a UTI just from sitting, watching television, it's interesting. And then they're treated with an antibiotic, but nobody's guiding them to take a probiotic or eat these certain foods. They just think eating Activia is going to take care of it, because it's on TV right after the NTV news, it's like, yeah,
All good?
Oh, you got to have questions. Yes. Okay, Tara.
Excellent question.
What are your thoughts on hormone replacement therapy and with gut microbe and how it would impact your testing?
Yeah, that's a very good question. So HRTs are a temporary solution, I would say. It can give a temporary relief, but it will have a long-term effects. So it's not a sustainable treatment. It's better to look through the diet or the more natural ways to address that. If it's necessary and then it has to be done, you can do it, but then it has its own long-term effects and the benefits might be only temporary, and then it won't help you to understand how to manage yourself for a longer, and healthier life. Yes.
And it's forever changing. Like the more we know and the science around estrogen, it's forever changing. Like some people need it and others, and how it just think about it. Years ago, we didn't have an estrogen patch. Now we have a patch, and now we have creams, and we have lotions and potions for everything, and pills, and it doesn't work for everybody. That's the thing. The microbiome is so unique in every one of us. So is our hormone panel. It's so unique. And to know, now, like I'm this age, and they're young whippersnippers, they can get a baseline hormone level. That wasn't even talked about when I was 30. Now I'm in my 60s, and I'm like, I'd like to have a hormone panel. And they laugh. I'm kidding. They don't. They do it. Okay, there was another question. Melissa.
I'm not sure if I'll ask this properly or not, but I'm wondering with the gut check, for those with histamine issues or renegade mast cells, I've often had issues with taking the probiotic and having reactions to them or reacting through my cycle when everything else is inflamed. Have you heard anything about a reduction in histamine response by having going through the gut check specifically?
That's a good aspect, but then we never measure histamine angle when it comes to gut microbiome. And talking about intake of probiotics, I think my way of looking at is to understand if it is necessary for you, right? Do you know if that probiotic is necessary for you?
No, everything's just been on suggestion, and I have a supplement graveyard.
Yeah, so it really doesn't help. So yeah, it is hard to just say there are a number of probiotics on the shelf. So we have to really know. They don't harm you, but then you have to understand if it's serving the purpose that you are working for. Yeah.
I mean, your microbiome is going to change as soon as you drink a kombucha. You're going to leave with it.
So given that there's big differences, so if I'm a vegetarian woman living in the Northwest Territories versus a carnivorous woman living in Newfoundland, how do I know what is normal? How do you decide when you find a normal level?
In terms of the diet, you mean?
Of your microbiome.
Okay, so Purvi want to address that?
No, hi, I'm one of the co-founders. Sorry. Sorry for taking your question because I couldn't resist. So I'll just talk about the probiotics and also connect with you because there are a lot of misconceptions about probiotics, right? And Gutcheck is a start to understand what probiotic is suitable for you because we have seen, like I would say, like hundreds of clients who are taking probiotic for more than a year, whether not knowing whether it is required for them or not. But when they test it, it's completely zero because it's so much things happening inside. It is not about taking a probiotic. Whether there is a suitable environment created inside your gut for that particular bacteria or not is very important, right? And how can you do that? That's only by the form of food. Like, you just create that environment before even introducing the probiotic so that it will be suitable to survive. So, and having not knowing what specific probiotic is important for you, it will be a kind of overgrowing the same bacteria again and again, or sometimes like you are not even, it's not even helping you anything. It's just staying there and going down just like that. Coming to the differences, yes, the kind of analysis which we put into, I don't want to go into too much technical, but we developed the health cohorts from different regions, ethnicity, age, and what stage of they are in, like whether they had a recent surgeries or anything, how much antibiotics they have taken right from the childhood. All this information is taken, and we include that in our advanced AI analysis, and that's where it comes more specific for that particular person. So definitely there will be a difference between when you compare a carnivore and Newfoundland to the Northwest Territories. But when we compare and provide you the analysis, that would be more specific within your cohort. That's how it is different, yeah.
Also, I had a retreat about a year and a half ago, and there was women from different places all over the world, and they did the gut check because I just happened to be involved with these guys. So when I reviewed their report, I'm just telling you guys this now, it was interesting because the US gang, they were from Nashville, LA, Michigan, like all over the place. every one of theirs was a bit different, and all the gals in Newfoundland had the same composition. Isn't that cool? Like, that's so cool. This shit works. Like, it's.
That's very true, actually.
Just to add on one more interesting thing is I had in our consultations, we have seen a couple, husband and wife. One is allergic to pets and one is not. So when they did the test, it's clearly visible. The people who was engaging with the pet has a different microbiome. The person who is not is having a different microbiome, even though they're eating the same food. But that's what microbiome is everywhere. It is surrounded around you, inside you, and wherever you go, it is there, right? So you interact with it more. And that's another example of how different it is within the same household people.
And also look at how COVID just cleaned out everything, right?
Exactly.
We antibacterialized everything. We sterilized everything, and everyone was starting to get sick. Everybody's getting all these immune issues, and like, we have to think about that. Like, we have to, yeah. And then we had to boost up our microbiome again, and we had to get back around people again.
Yeah, talking about the different diets and the geographies, I'll share my own experience. So I'm originally from India, southern India to be specific. And I moved here in 2012 as a PhD student at MUN. And little did I know about diet that I was taking as my mom was cooking for me. And I started to lose weight because of the anemia. I had severe issues because the diverse foods I used to take back home unknowingly, and then all of a sudden there is a shift, and then there is a lack of knowledge that what I'm eating. Am I relying on that cereal, being a PhD student, or am I eating more diverse foods, right? And then my absorption capacity for iron went so low that I became anemic. I lost 8 kilos. So now I can correlate everything, but then it's a very important aspect as well to look at if you're migrating or moving from one place to the other. What are the changes? Are you still sticking to that diet? What is it that you're missing? So how are you managing it? So it's a very essential component, even if you're changing the diets from vegetarian to carnivore to vegan, whatever it is. So understand yourselves better before you make that move. So yeah.
There is one more question online. I mean, maybe this is for you, Nikki. Do you need a doctor to review the report or the results provided with suggestions?
It's a mix. So for the individuals, we'll give enough information to understand. If you have a health practitioner, because we are partnered with several of the health practitioners, right, from naturopathic to nutritionists to dietitians to physicians to gastroenterologists, who help you to understand your case better. So if you are having other health issues, whether you're diabetic or whether those aspects are also brought into the picture to help you understand better. But the report in itself has enough information. If you're not having the severe health conditions and then you want to work on your microbiome, you'll have enough information to make those dietary changes and include that into your day-to-day living. Yeah. So Sara, do you want to add something to it?
Yeah, go ahead. Yeah.
I mean, yeah, me as a dietitian, I go through it with my patients, and they do find it was so much more useful to go through it with a practitioner. But I do admit the report that is given to consumers, it's very, very well written. I do a lot of genetic testing where they also generate reports for patients, and it's not as easy to understand from a patient's perspective. So the way it's very well done. But like Nikki said, I do bring in all the factors that my particular patient's going through, and then we're able to really formulate a strong plan so that they know how to put in these results into practice. So it's not just like, oh, well, that's a nice to know. It's also, okay, what's our game plan? What are we going to do to help rebalance things and make you feel better?
Yeah, I do the same thing, and I'm just really hoping that this test, gets into a lab, that just like you get a blood test drawn, that someone, if they request a gut check, that it's done. Like, yeah, I think it'd be a really good test because it is out of pocket right now, and some insurance companies cover it, but that's the plan, I hope, because it is a great tool. Yeah, it's great.
And I have another question. I don't mean to get all competitive with my gut microbiome, but if we're targeting something, would we not want to target, like, say, people on the Mediterranean diet who live to be very healthy and 103? Like, are we sort of, can we have a target profile that we're going for?
So when you say target profile, do you mean the type of the diet? Or,
No, the microbiome again, like.
Oh, okay, the microbiome. So we go by the baseline what you have. So currently what you have, and then from there where you have to go, whether it is to enhance the diversity or increase certain beneficial bacteria, or if you have any pathogenic bacteria, do you have to address that? So those aspects you have to address, and then which will allow you to work towards, because it's not talking about profiles like whether somebody is following a Mediterranean diet or somebody's one. It's a correlation between some of the components that are present in your food that is helping certain bacteria to grow or reduce. So yeah, that's the aspect or the correlation. I hope it addressed your question.
Sort of, but I'm just wondering what the microbiome of a 103-year-old healthy person looks like.
I wouldn't bother if she's 103.
It's like a score you need to reach, right? That's what you're asking. If it is 100%, no. Everybody, I mean, one of the best thing, whether the improvements is coming or looking at your symptoms that you're going through, right? So as I said, like the 103 years old who is living in Italy or a Mediterranean diet, full diet, his microbiome will be entirely different, but we don't know what the symptoms he's facing. Like it could be, depends upon the, like it's a bone strength, or is it like any IBS related issues, the constipation issues. That's, if there is any target that we wanted to achieve through the gut check, it's improving the diversity of good bacteria and also reducing the symptoms that they are going through when they did the test. So, and we have seen that more than 87, we are proud to say that in the past 1.5 years, we did a survey with all our gut check customers also. 87% of the customers who has done the gut check have reduced symptoms. And it includes different symptoms like, sleeping issues, IBS issues like, constipation issues, and more importantly, the mood swings in women because of the gut-brain axis connection that is looking into, and several case studies here.
Yeah, and talking about the 103 or the more aged people, I don't think there has been a study to just populate that aged people, as we see the blue zones in the world, right? Where there are healthier people who are having a longer lives, especially in Japan, as we see. So there is several factors to it, but I don't think they looked at the microbiomes for them. Yeah, I'm sure there will be very diverse microbes for them. Because athletes, farmers who are physically active or who are taking care of themselves, who understand, who are in a slow pace of life, they have very diverse microbiomes. Yeah. Yes, is the key. Yeah. Yes.
Diversity. All right.
And one really beautiful keynote is like, I've been to Southern India and my gut biome totally changed. And when I came home, you can balance it. I balanced it there. You go anywhere you travel in the world, your biome's going to shift and change. So that's why, at any age, it's continually shifting. And when we present with symptoms of any kind, that's the first thing to do is check the gut, because that's your signal on the dashboard, I think. Anyway, that's what we all think, I think.
You can,
And, just around aging population, I have seen studies where people that do tend to live longer lives actually have very high strains of Akkermansia. And I think you had mentioned this at one point. And that particular strain is hugely preventative for a lot of metabolic diseases, as well as a variety of cancers. So people that tend to live around 95 to 100 years old, they tend to have that particular strain being quite high. So we know there's a link there.
So if that shows on your gut check, that's a good thing.
Yeah, and that's part of it.
time for just last question. Yeah,
Okay,
just
one
last
word they
question.
said.
Yeah, thank you for all the great talks. And so you're just mentioning like you hope to have this test included in hospitals, like a blood test. So my question was, what are your thoughts about having such a test in clinical protocols for screening or diagnosis?
Very, very good question. So we have started this in India, and also we have worked with one of the gastroenterologists here who are combining this test for the therapeutic intervention. The only thing here in Canada is it's not covered under insurance, as the system is, right? We are known, and we are depending on the medical care, and then it has to be included into it, which can support a larger population who can afford that. So that will be the difference. And by combining the treatment and looking at your microbiome would give better results. That's what I've seen, whether it is with the, so far the physicians we have worked with or the gastroenterologists that we have worked with, the outcomes are good. So soon you will see a lot of publication data that will be coming out indicating that. But yeah, it's a very important aspect that needs to be included into as a holistic approach. Apart from the regular treatments or the tests that they're doing, they have to include this aspect as well in order to consider how they can manage the treatment. Yeah. Right?
Thank you. Round of applause for our lovely speakers. And Jenny, who's online still. So we just want to thank you all for being here with us tonight. Gutcheck VIVO is more than a product to us. It is a step towards a more personalized, inclusive, and empowering approach to women's health. Before we officially unveil what we've built, just one more quick reminder, Gutcheck VIVO is available for purchase tonight at a special event exclusive price. It's just over here, again, at our one table, so you can't miss it. So it is now my pleasure to invite Dr. Candiala and Dr. Palagar, co-founders of Nuclic, for the official unveiling and launch of Gutcheck VIVO.
Thank you, Cassie. And wow, it's excellent, and I'm thrilled actually to listen to this incredible woman talking about microbiome, and my gut bacteria just stood up and started applauding out it. I was just thinking, listening to them on the back, and especially when Eddi was mentioning about she loves to listen when the couple discussing their Gutcheck reports. And as part of the Gutcheck, we also offer the consultations, one-on-one consultations. Now I'm thinking for the Vivo, for all the women who is doing the test, I should book the consultation with the husbands and to tell them one about the mood swings when they can expect coming out of the symptoms here. So jokes apart, and I'm very grateful, and both me and Nikki, and I still remember the day when we discussed about the Gutcheck VIVO, and it's a journey of passion and perseverance, and more importantly, I'm incredibly proud of our team, especially the R&D team, who puts a lot of efforts into this and bringing this into reality. And right from it took us, I would say, like more than years to launch Gutcheck VIVO because of the complexity of the data that we deal with, especially when we are discussing about the hormonal health and connecting with the gut microbiome. And as you listened a few minutes back about the estrobolome, where estrogen and microbiome is nothing but the estrobolome, and the symptoms. And during this journey, we listened to mothers talking about the issues that the young girls going on, about the issues dealing with the puberty, and mothers also talking about the menopause issues and the symptoms that they're going through, and without knowing the actual answers. Gutcheck VIVO will give you the root cause about how you're balancing. When we talk about hormones, it's not about increase or decrease, it's about balance. And the same thing applies for the gut as well. We are not looking for increasing any single bacteria, good bacteria, or not decreasing certain overgrowth. It is about bringing the balance, how we bring the balance. And more importantly, it's all many people come to me and say like, okay, I'm craving for sugars, I'm craving for eating so and so foods. I tell them, it's not you craving, it's your bacteria craving for that. And there was a saying you all know about, you are what you eat. But at Gutcheck, we call it, you are what your microbes eat. So feed your microbes so that they can feed you with a good health, right? So as a closing remarks, and I don't want to take much time, and I would like to thank our team, R&D team, and the lab, all the staff who are part of Gutcheck VIVO and part of Gutcheck too, and all the funding agencies that are being support to bring this into reality. And when I still remember the day when I just came here in 2014, I was telling Nikta, I moved from London, Ontario. After finishing my master's, the first thing I told is, as soon as we are done with our PhDs, we should move out of this rock. But now, after all these years, now I have 2 kids, a house, and we love this place.
Yeah, to be clear, we are husband and wife. So
Yes. See, I sometimes cheats about our mood swings because I know the microbiome report that is going on. So I know how to tackle when you look at a report. Okay, I get that and see that. But yeah, and we thank to all the ecosystem that has been very supportive. We are here because of all that support. And I also take this opportunity to include all of you in unveiling the new product, which is our Gutcheck VIVO. And I would like to, on the count of 1, 2, 3, we all say Gutcheck VIVO, and the product will be officially launched. You might be seeing all the boxes, but it's officially launched. Nikki, can you take that?
yes, I'm clicking the button on behalf of all of you.
1, 2, 3, Gutcheck VIVO.
Yeah, if you have any questions, please feel free to reach out as you're here for the rest of the night. And once again, I thank you everybody and people who have supported, especially the R&D work, which has been supported by both federal and the provincial funding, IET, NRC, IRAP, ACOA, Emergence. So there's been a lot of support that has been gone through, and work, of course, by our team. So yeah, thank you, and thank you all for being here.
Yeah,
have a wonderful night.
Thank you.
Gutcheck VIVO, tailored for women, backed by science.